The intensive care unit is often seen as the most intimidating place in a hospital. Monitors are constantly beeping, patients are critically ill, and decisions must be made quickly. For many nurses, ICU nursing feels like a world apart from general care. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. A common misconception is that ICU nursing is mainly about advanced machines and complex technology. In reality, critical care nursing is about recognizing instability early and responding before the body fails. Technology supports care, but nursing judgment drives it. Think of ICU nursing like flying an aircraft through turbulence. The pilot does not focus on every dial equally. Attention goes to the indicators that signal immediate danger. Critical care nurses do the same. They prioritize vital signs, organ function, and trends that indicate deterioration. At the bedside, ICU nurses continuously assess airway, breathing, circulation, and neurological status. Small changes matter. A slight drop in blood pressure, altered mental status, or reduced urine output can signal organ failure in progress. Nurses act on trends, not single readings. Understanding physiology is essential in critical care. Ventilators support breathing, but nurses monitor lung compliance and oxygenation. Medications support blood pressure, but nurses assess perfusion and response. Each intervention has a purpose tied directly to organ function. ICU nursing also requires close collaboration with the healthcare team. Nurses communicate changes promptly, clarify orders, and advocate for patients who cannot speak for themselves. Clear communication prevents delays and errors in high-risk situations. The NClex introduces critical care concepts by testing prioritization and safety. Questions may describe multiple unstable patients and ask which one requires immediate attention. The correct answer usually reflects compromised airway, breathing, or circulation. In real clinical practice, ICU nurses develop strong situational awareness. They anticipate problems, prepare for rapid intervention, and remain calm under pressure. Experience builds confidence, but the foundation is systematic assessment and critical thinking. Critical care nursing extends beyond the machines. It includes supporting families, maintaining dignity, and guiding patients through recovery or end-of-life care. These human aspects remain central even in the most technical settings. Now that you understand the core mindset behind ICU and critical care nursing, the next step is applying this thinking to complex metabolic emergencies, where rapid assessment and intervention are essential. That connection becomes clear in diabetic ketoacidosis. And that's exactly where we'll go next here at the Learning Studio.